welcome, and many thanks to each of you for taking time out of your busy schedules to join us for this series, Finding Hope and Meaning Through Stories during the COVID-19 pandemic. I think we'll start with our first question. And Helen, how has the COVID pandemic really affected you personally and professionally?
You know, the pandemic has totally changed my way of life. I used to spend about half my time in the air and at meetings around the world. Now I'm at home cocooning with my husband and my daughter. It's given me a lot to think about. I've been thinking about the importance of family and of home, but also about the hard facts of how much we can really accomplish. I've devoted 20 years of my life to patient safety and patient engagement, and I think they've both taken a big hit in this pandemic. I think we need to rethink our entire approach, and I'm really pondering that hard. I'm trying to figure out what works, what will endure even when people are in panic mode, what we need to prioritize. I've got some ideas, but I'm still looking for answers.
Thank you, Helen.
Crystal, how has the COVID pandemic affected you personally and professionally?
The COVID pandemic, I'd like to talk about how it's affected me personally first and then professionally. Personally, for those of you that don't know, my husband is a primary care provider. So personally, seeing him walk out the door every day, being on the front lines of it as his wife has really impacted me. It's created a lot of fear. And for our family, especially and my youngest, has created distancing from him. And it's really hard to see that and to feel that. Personally, there's a lot of fear there still. Professionally, I've been redeployed, for those of you that don't know, back into a role that I did previously, and that's care for the caregiver. And so I've taken on that role for MedStar Health. And historically, we did more of a pull, waiting for folks to come to us who really needed that peer-to-peer support. But given the current state of affairs, we know that that's not the right thing to do. And so we've changed our approach into a push. So we're actually collaborating with the wellness physician champions and taking our program to the front lines through wellness rounds and setting up office hours. So it's really changed my job quite a bit these past couple months.
Yeah, Crystal, I'm really excited to learn more about the care for the caregiver work that you're doing, and I'm hoping that it's something that could be scaled and shared across the country, because it's needed. So kudos to you and the team that you're pulling together. Great work.
Hi, Josh. How has the pandemic affected you personally and professionally?
Well, most immediately, I feel it right now in my chest. I feel tightness in the middle of my chest. It comes and goes in waves, and that's a strange thing to feel. I'm 6.5 weeks, 47 days, I think, into having COVID, and my experience has been one of a lot of fear, a lot of uncertainty. I remember when the stay-at-home orders first came in mid-March, is this generalized fear of that we all feel of, will I get this? When will I get this? If I get this, will my mom get this? And then that transition to the specific fear of the statistics of, oh my God, 1 in 100 people or 1 in 50 people die from this. And that would be in the next 2 weeks or 3 weeks. And so dealing with that has impacted my life. I've written about it to just try to get the experience out and explain from the inside out what it's like for one patient. I would say I'm not mild, I'm not severe, I'm not admitted to the hospital, but I'm moderate, and there are some scary episodes, and they continue to come, unusually I think for most patients, but they continue to come for me. But it's given me a lot of perspective and appreciation for just the gift of breath, the gift of every day being alive and being able to appreciate small things. Professionally, it's been interesting to see some of the companies that I advise, mostly in the technology space, have to adapt. And there's one particular a team management software company that has launched a new product around compassionate conversations. They never would have added this as a focus, but it's what is needed right now. And it's actually been a beautiful thing to see people adapt to the deep human need that's emerging all over the world and to try to do their part. So it's been good to see that, and I'm trying to find my way to contribute. One way I've been trying to contribute is to connect with other COVID patients, and so I've launched something called COVID Cohorts that's trying to put us together so we have someone to talk to.
Thanks, Josh, for launching COVID Cohorts, and I've also read what you blogged about it. It was a beautiful piece.
Fonda, I'm going to go back to you. And I know you mentioned that you're trekking across the country, but how has the COVID pandemic affected you personally and professionally?
There are probably more ways than people would even care to know. I'll get down to some just really basics. So for example, I had completely let go of my lease and I can't shelter at home. There's no actual home to shelter in. The first 2 legs of my trip had to get canceled because I could have been a risk to the families who were going to host me. I'm spending more time in hotels like today than I anticipated, to be sure. Simple things like when I'm driving long distances, the typical services that we're accustomed to are not necessarily available. Some of those very basics. I was hoping to stop by some of our national parks along the way, and so far I've not been able to do that. I would say those are very minor inconveniences, though, compared to some of the other things that are happening for people who need to get out of their home and be in service. On a professional level, it's rather interesting because on the one hand, a lot of things got canceled immediately. Like Helen, I spent a lot of time traveling through the air. That's not happening. On the other hand, thankfully, a lot of what our craft is in working with people in the virtual field, like Zoom, coaching, consulting, and things of that nature. And the need has only increased in terms of helping people manage their nervous system, find ways to breathe through the unexpected and the unanticipated, and just really helping individuals as well as teams get a handle on being able to be more of a go with the flow state right now. So those are just some examples.
I hope you're journaling because it sounds like it's a book in the making.
Our next panelist, Tim McDonald, who's also been working on compassionate conversations. So Tim, why don't you tell us how this pandemic has affected who you are as a person and what you do professionally?
Thanks, Marty. From the personal standpoint, there has been a huge silver lining for me because I'm quarantined, at home here in Burr Ridge, and I'm fortunate enough to be with my wife, my daughter, but also my granddaughter. So I'm now on 56 straight days of getting to hang out with my granddaughter, which is just an amazing opportunity I know I never would have had if I wasn't, required to be home with her. So from that standpoint, even though it's scary, I wear a mask when I go out all the time now. It's so kind of crazy and unusual, kind of almost the new normal, but have tried to find some of the silver lining there. On the professional side, one thing, and I would agree with Josh on this, what I have seen is, a whole lot of my work is going into organizations and helping to train them in empathic and compassionate communication. And we've been able to really take advantage of Zoom technologies and these sorts of technologies to deliver those messages. The other thing we've been able to do is to create scenarios with the actors that we've often used in our candor training that are all COVID-19 specific. And they really do a great job of demonstrating how we can be more empathic and compassionate, especially now that we see the need for care for the caregiver more than we've ever seen in the last 20 years I've been involved in this kind of work.
Thank you, Tim. Tracy, back to you.
Pat, for someone who's traveled the globe very frequently and recently, how has COVID and the pandemic really affected you personally as well as professionally?
For personally, it has affected me in so many ways. One, I feel I've gotten closer with my husband, George. Even though we've been married for, decades, it still seems like there's this opportunity to have this closeness. On the other hand, I also miss terribly my children and my grandchildren because I can't be able to see them as well. And then for the international, as you mentioned, I do love the international travel. I love the different cultures and the opportunities to make a difference and apply the skills that I learn here to other countries. But there's another one. I do work on several boards, but I also volunteer with a children's hospital in Chicago, and I've been there 29 years. And so I really miss that. And that sort of, transfers over to my professional concerns too. I know that right now hospitals and nursing homes are on lockdown, no visitors, no family members, no chaplains, no volunteers. And I know how difficult it is for the hospital staff without those additional people to assist. You know, I used to see on CNN or any of the broadcast channels where people would be at end of life and they'd be holding on to a nurse or a staff person providing that compassionate care, or in a nursing home where the families are frantic because they can't get a hold of their family members. There's many issues going on there. And so what I did is I worked with a number of groups, and we provided our first time around with dozens of iPads and thousands of PPE. And now we're on the verge of, we got major funding. We'll be doing close to 200 iPads for safety net hospitals and nursing homes in the Chicago area. So putting that volunteer work to use.
Pat, that's great. Good to hear. Thanks for all you're doing, especially for the safety net hospitals in Chicago. Marty, I'm going to pass it back to you.
Steve, I'm very curious to see how you're going to answer this question, because I know you have been a family caregiver through this pandemic, but how has the pandemic affected you personally and professionally?
It's been a little different for me throughout my career, because my personal basically is my professional. Basically no separation, there never really has been. And then with the advent of our film Bleed Out, which was largely autobiographical about my mom, and also completely, the personal is the professional. So we were having such a really great run with the film, and we felt so fortuitous that with all these wonderful people we've met in the patient safety movement, bringing it out to especially the medical practitioners and all of the universities and medical schools and stuff. And then when this coronavirus hit, it just stopped. And at literally the exact same time that thing just, our film was a huge pause, as I'm sure that Helen and Von have already expressed that, their traveling just stopped as well. My wife, who will tell her story in a bit, broke her foot in 3 places and had to have surgery like in the middle of this thing. And she needed to have a 24/7 nursemaid until basically yesterday when she got her cast off. So we've been in almost like double lockdown. We've been in quarantine, lockdown for the COVID, and also quarantine with her foot. So it's been a strange, surreal experience. And I can honestly say, for the first time in my entire life, I always have a plan. And this is the first time in my entire life I do not have a plan. I'm day to day, hour to hour, and I don't say this lightly. It's kind of very frightening to me. I don't have a real grasp of what the hell is really going on out there.
Thanks, Steve. Margot Burns, how has the pandemic affected you personally and professionally?
Having broken my foot right before all this started, I had major surgery on March 11th. My experience is probably the total opposite of Josh's, because I came at it from a totally non-COVID perspective because I needed the surgery on March 11th. And that was one of the last elective surgeries here in Los Angeles. It was very strange. My doctor's office cut down to 1 day a week. I was no longer able to see my surgeon because he was a little bit of an older gentleman. So he's actually in practice with his son, so I'm seeing his son. So it's kind of like back in Bleed Out days, because I'm getting 2 different opinions, total lack of communication. They put me in a rehab facility for almost a week. The day after they put me in on March 12th, everything shut down. I felt like I was in a petri dish, just waiting to get COVID. And this was in the early days, in the public's mind. So nobody really knew what was going on, what was going to happen. It's a very strange experience. Feeling very vulnerable because I also have multiple sclerosis and I'm totally immobile now. So I'm just starting to move. The therapy, all that has been put on hold. So trying to figure out how to rehab now is a whole nother story. So it's a very anxious time because right now we have no income. Bills are still coming due. I have the worries of healing. I also have the worries about getting COVID-19. So it's a pretty tough time for me and everybody out there. So.
Thanks, Margot. I had forgotten that you had been in a rehab center. I talked to somebody today who's been in one for 6 weeks because he can't get out. So I'm glad you're here with us today. Although it just sounds like your challenges are pretty profound. So thank you for being here. Tracy, over to you.
Dave, I know you've been hunkered down in Arizona for the last couple months and really using this time to reflect as you walk and work. How has the pandemic really affected you personally and professionally?
Tracy, I think the best word is depressed. I think depressed on many levels. We are all on this panel know about the 200,000 plus lives that die from preventable medical harm, the patients we lose each. So many of us for many years have been saying our healthcare system is stressed. It's at capacitance. And if you didn't believe that, just spend 12 hours in an inner city or urban emergency department one evening and see the people waiting in the halls, see the people who can't get access to care. We knew about healthcare providers having 1.5 times the suicide rates of the general population, the depression rates, the burnouts of people leaving healthcare. And that was before this pandemic. I could only just imagine what the system's going to look like in 2 years with people just walking away and saying, enough's enough, I can't do this anymore. And so much of this was preventable. We lived through Ebola. We knew what it would take when we hit a true pandemic like this, and we were so unprepared. It's depressing because I see caregivers like Crystal, I hear the stories, friends and colleagues, and there's times I wish I could be back in the clinical realm and be with them, but I've been out of clinical practice for 10 years. And then like Josh, our youngest daughter was very sick with the virus and her boyfriend, and I wanted to get on an airplane and fly there. Well, what was I gonna do? As we see patients and families can't be together during this time, and the emotional loss of that connection of patients dying and not being able to have family members even allowed into the hospital where they're dying is something that we couldn't have imagined the state we're in healthcare. I just posted today that 260 nurses have lost their lives and over 90,000 healthcare providers have been infected with the virus. And so much of this was preventable. And so I think it's really unmasked the deficiencies in the US healthcare system, and is one of the smartest, most financially rich countries in the world. We look like idiots, truthfully, and it's a shame moving forward. So that's why I walk, because it allows me to get those frustrations out and to physically and mentally be out there. But it's really, I think, a struggle for all of us.
Thanks, Dave. Yeah, I feel your frustration and share your frustration. I think, documenting these stories, documenting this time and our experience is really gonna help change the future. I really believe that. I have to believe that. Thank you all so much for participating in our Finding Hope and Meaning Through Stories during the COVID-19 pandemic series.